And happy Monday. You are watching the Owatonna Today Show. I'm Shelley Whitehead. It's a joy to have you with us. We love that you join us every Monday through Saturday right here on Charter Channel 8. If for some reason you can't check us out right here, do know that you can find us on YouTube, Blip TV, and of course, Facebook. That's the great thing about Facebook is if you do like us on Facebook, what we'll do is we'll post our new episodes every Monday, Wednesday, Friday, and then you can just check it out there. The nice thing also about liking us on Facebook is when you do that, you will be registered for a pair of tickets for the Steele County Blades home game. It's a great opportunity for you to join us and have some fun with your family this winter. We would always love to hear from you. If you do have some ideas of what you'd like to see on the show, please send us an email at owatonnatoday@charter.net. That is also another place you can send for those tickets. And then also if you have any great ideas of what you'd like to see, Leanne would love to hear from you. Her number is 390-5751. Give us a call. Let us know what you'd like to see right here on the show, and we'll think about it because, you know, that's how we roll. We've got a great show for you today. We're going to be talking to the Owatonna Clinic as well as the music boosters right here on the Owatonna Today Show, so stick with us.
I'm Dan Branstead of Carlson Branstead & Company, Certified Public Accountants. We support the Owatonna Today Show.
Owatonna Public Utilities, real people, real reliable, real progress. Making life a little easier day after day, taking pride in our community, listening to what you say, a voice you can talk to. We're growing with you in mind in everything we do. Owatonna Public Utilities.
Hi, this is Laura Ressler greeting you from the Steele County Historical Society's History Center, where we're honoring the past and looking towards the future. We're proud to be a sponsor of the Owatonna Today Show.
And we're back. I have with me Stephanie Olson and Dave Berg. Hello, gentlemen and lady.
Good morning. Good morning. So nice to be with you, Shelley.
I'm seeing double, so I thought there was more of them than two. It's so good to have you here. I want to thank you so much for joining us today because we do know that the Mayo Clinic is such an important part of our community and they do so much for the health and wellness of everyone. So what we'd like to do is, first of all, if you wouldn't mind introducing yourself, telling us a little bit about each of you, and then we're going to talk about 2012 and what's coming up for 2013.
Terrific. Very nice to be here. I'm David Berg. I'm the Chief Administrative Officer at Mayo Clinic Health System-Owatonna, and I've been here a long time. I came to Owatonna in 1994, and so pleased to still be here. There's been so much good change at Owatonna Clinic, at Mayo Clinic Health System, and now Mayo Clinic Health System-Owatonna. That has just been fun to be part of it. And so I'm happy to talk with you about that this morning. I'm here with Stephanie Olson.
Good morning, Stephanie Olson. I'm the Public Affairs Manager for the clinic. I've visited with you once before. I'm very proud to represent the clinic, not only in the clinic, external, internal communication, but also to promote our community activities throughout the year.
Which are many.
Yeah, there's about 8.
And I think that's fantastic.
Well, thank you.
Yeah. So, David, let's talk about 2012.
Sure.
What happened is a lot of cosmetic changes as well as internal changes.
Right. 2012 was an exciting year for us, really a year with lots of transitions. And it's always good to look back and say that some good things happened, some ways that we can serve the community differently and better. Let me just tell you about a couple of those. One that I think is rather invisible in the community until you need it is a change in our emergency department and our emergency services. This year, for the first time, we have board-certified emergency room physicians staffing our emergency department. Dr. Skip Powell, board-certified ED physician, joined us this last year, and then Dr. Beisman joined him later. And they're working with our ED staff to take care of patients that are really sick and need to come into our emergency room. And that raises the level of our care. It helps our care across the board. Another related change is an increase in our hospital service. Right now we have hospitalist physicians that take care of patients that need admission to the hospital. And we increased that from 2 staff to 4 staff in 2012. One of the new staff in that role is Dr. Carol Winter, Many people in the community know Dr. Winter. Carol Winter has been part of the community for more than 20 years, taking care of patients as an internal medicine physician, and now has moved her practice entirely to the hospital. So we have 4 hospitalists. They work very closely with that emergency room department to make sure that patients have good access to hospital services. So that's a couple of examples of things that have happened that the community doesn't see until they need it, and then it's there for them at a very high level of quality and service. And most important, there's access to those same services. So those are a couple of examples of things that are kind of fun, that are very meaningful to the community.
Well, and Steph, there were some great things that happened in your department as well in 2012.
As far as our community events, we were very successful with our walking program, which is in April. And then the other one that we really are excited about, again, it'll be the 11th year this year, was our Women's Health Day. We had over 190 women attend at the Holiday Inn. And having our 10th anniversary celebration was really fun, and now we're already planning for this year, 2013.
That's exciting. In 2013, I know as a hospital you have to continue to grow, as you know, and social changes as well as technological. What kind of things can we see happen in 2013 for the clinic?
Certainly, and the challenge for us is to really continue to assess community need, and then to make sure that we meet that need in healthcare. And what you can look forward to in 2013 is a continued increase in services. We'll continue to round out our service lines, and you'll see and hear more about that over the course of the year. We are very invested in making sure that our community has access to the very best primary care. So whether it's the same-day clinic, pediatrics, internal medicine, family medicine, OBGYN, we want to make sure that our patients have that same-day access so they can come and see a physician when they need to. You'll also hear us talking about and working more across the health system. So Mayo Clinic Health System will have initiatives that really go across systems. This year we'll be working more closely with the practice in Faribault and Northfield. We're actually becoming a single business entity. That happened just recently, and so you'll see us work across the communities better together.
And so does that mean not only for programs, but also if one person has to go from one clinic to the other, that'll be also a smoother transition for those patients?
Absolutely. We should continue to see an improvement in the care from community to community. The medical record is very safely shared between providers, between communities now. And with improvements in the phone system throughout the year, you'll start to see that. At the end of the first quarter, we'll have a new phone system implemented. Those transfers and those handoffs between communities will be even more smooth.
And what kind of benefits do you see this happening? Because we can share those services, but what does that bring to us as a community when we start sharing those throughout other communities?
Well, one of the real challenges in healthcare today is access to primary care, and we've been sort of protected from that in Owatonna, but more and more across the nation we're seeing that it's very difficult to recruit and retain primary care providers. They're in short supply. Our population is aging, and so there's fewer and fewer people to work in those roles and to serve those patients. So being able to work across those communities will help us share that resource better. Another aspect of that you'll hear about, and we'd like to come back and talk to you about later this year, is some care coordination activities that we're going to be doing so that we'll start to work as a team taking care of patients with particular diagnoses. So let's say someone has diabetes and heart disease. We'll have a care coordinator that can work with them to help them not only with the diagnosis, but the overall health as they're going through that. Through the recovery from that.
Well, it sounds like a vital, important process to the process of healing.
Absolutely it is.
Well, let's talk a little bit about what community things we can see from the clinic in the next year. Stephanie.
In the next year, we're going to be partnering with the Park and Rec, and we're going to be doing our walking program again.
Now talk a little bit about that walking program.
Well, this year we're going to partner in the fall with Park and Rec, and we're going to be moving our On the Move to the park trails.
Ooh. Which we have with so many.
You know, every year we've tried to really emphasize not only the trails in the community, but also the hospital indoor walking path. And our walking path out at the healthcare campus. So we really want to enhance for the community to get out and walk, but also there's other venues such as West Hills, the inside walking trail at the hospital. So you'll see that grow, and there's a few, working with Corky, a few nuances that will be exciting to keep people out and walking.
Good.
And, you know, talking with the school system, that spring is really hectic with track. So we look to the fall to make sure people continue even though the weather may change.
Oh, which is an important thing to know, because here in Minnesota, sometimes it gets cold. And
Yes.
it might not be conducive to go outside and walk. So having those inside places is a good asset for us to have.
Yes.
Good. And what other things can we look
And
forward
of course the Women's Health Day, a bigger player in the Relay for Life.
to? Okay.
That has always been a big thing for the clinic, but now again with the hospital, growing it larger, more and more people are impacted not only in the community but also our internal staff.
Okay.
So we have some leader roles in that event as far as chairs. So you'll see that. You'll see us out in the track again. The Women's Health Day, our United Way campaign is always successful. In our transitional housing program,
Okay. Talk a little bit about that.
we partner with Julie Anderson and the Transitional Housing Organization, and we adopt 12 families for Christmas, and departments choose a family and they go out and shop for that family to really give that family an opportunity to have a Christmas. And we just did it again in December, and it was exciting. People are engaged, staff, the room is filled with Christmas gifts. So Spirit gifts, celebration, and Julie comes out and gets all the gifts, and they take them with a U-Haul out into the community. It takes a U-Haul.
Nice. That's fantastic. Dave, it is, I think sometimes people forget that you do want to hear from the community members. You want to know what's going on. How can people contact you? If they have concerns or ideas for the clinic and some of the services they provide, how can they contact you?
Well, certainly, we have a patient family advisory group that meets regularly, and Stephanie actually coordinates that, so there are community members on that. We also have a community board, and we have members of the community that meet with us regularly to talk about what's happening at Owatonna Clinic and what's happening within the practice. And so those board members represent the community. Of course, they can always call the clinic and ask to speak with me or talk with Stephanie about things that they want to see.
Thank you both so much for your time today. We look forward to see what's happening in 2013.
Yeah, terrific.
Yeah,
Thanks.
have a good day. We'll be right back on the Owatonna Today Show.
Hello, I'm Sean McNulty.
And I'm Deb Gillard with Brookdale Senior Living, Sterling House, and Clarebridge of Owatonna.
And we are a proud sponsor of the Owatonna Today Show.
Hi, Ann Plaskanko here from Senior Place. Senior Place has new hours. Mondays and Fridays we're open 8 a.m. to 4 p.m. Tuesdays, Wednesdays, and Thursdays from 8 a.m. to 8 p.m. Participate in Zumba Gold, Bike Club, table tennis, computer classes, speakers, and much more. Don't forget the Senior Place Partnership Program with 39 businesses giving discounts and incentives with your Senior Place membership card. Membership is only $35 for the year, which comes to just $3 a month to be a member. Consider joining us today.
Hello, my name is Shannon Cliff. I'm the Patient Services Manager at Mayo Clinic Health System-Owatonna. I'd like to talk with you about our same-day clinic. Starting at 7 o'clock, you can call into the clinic where we will look for an appointment with your primary care provider. The second option, we would look to our same-day clinic to book an appointment. The third option would then be to have you walk into our facility to be seen. If you have any questions regarding same-day appointments, we'd be happy to answer them. Please call 451-1120.
Do you know how to safely dispose of your expired or unused prescription and non-prescription medications? Not by flushing them down the toilet or putting them in the garbage. Doing so pollutes our rivers, streams, and drinking water supply. Take it to the box instead for safe, secure disposal. It's easy. Bring your unused medications in their original containers to the drop-off locations listed on the screen and drop them in the Take It to the Box drop box. Proper disposal of unwanted medications keeps them out of the hands of children and out of our environment. This is a message from the Safe and Drug-Free Coalition of Steele County.
Hi, I'm Glenn Mager.
And I'm Tim Thomas of the Brick Mager Funeral Home, and we're proud to serve the Medford and Owatonna areas with cremation and traditional funeral services.
And we're proud to be a part of the Owatonna Today Show.
And we're back with the Owatonna Today Show. I'd like to have you say hello to Paul and Elizabeth Wiebke. How do you do?
Good.
Usually get it wrong. Tanya, Paley, hello.
Good
you guys
morning.
Are working with the Music Boosters here in Owatonna. Is that correct?
Correct.
And you have a big event coming up? Ooh, I'm so excited. Well, let's first of all, Polly, why don't you tell me a little bit about the Music Boosters?
Okay. Music Boosters is an organization that really supports all music programs throughout Owatonna.
Okay.
We advocate for education and not just in our schools, but in the community as well.
And then what do you now? Are you involved in the music? I see that you must have a musician in your family.
Yes, this is one of my two musicians. The other one's in college.
Okay.
Yeah, it's been a big part of our lives. Yeah. Both my husband and I had music in high school as well, and elementary, and it's a big, yeah.
Okay.
It takes up a lot of our time,
which
is good. It's very enjoyable, yeah.
Elizabeth, tell us a little bit about you. What instruments do you play?
Well, I play the alto saxophone in band, and then I sing in the concert choir, and I was in carolers this year too.
Was that fun?
Yeah, it was really fun.
Good. I see them driving around town with little hats on. They look very excited.
Yeah, it's fun to go out into the community and sing.
So, from your perspective as a student, what kind of things does the Boosters do for you as you're trying to, get better in music?
Well, I know that they provide a lot of scholarships for different camps we go to. There's an all-state camp that you can audition for, and that's a really good camp to go to help grow in your music, and they provide scholarships for that, and that really helps out.
Being a musician, is it kind of expensive?
It is. It can get expensive, so it's really nice that we have a support system.
Good, good. Well, Tanya, we've got one of the reasons that you're talking about, that Elizabeth was talking about, was the scholarships, and one of the ways that you do that is through the Music Booster program that you've got, this fundraiser.
Right. So we're here really to talk about our third annual benefit concert, and so here is the poster that has been put up around town. Hopefully, you're starting to see these at retailers, and. So Polly, as our president, has been, she and Dave, her husband, have been working on this for a long time, and it's finally coming. It's this coming Saturday, the 12th. And as you can see on this poster, I think this gives a nice idea as to the variety of different things that happen at the concert. You can kind of see. Here's Chris Harris singing. How often do you get to hear them sing, right? And then we had a fabulous tuba soloist last year, a student.
And then these were mostly from last year then?
These are pictures from last year, yep. And so maybe they can talk a little bit about who's going to be there this year.
I would love to know that. Polly, who can we look forward to this year?
Well, we do have MCs, and actually my husband Dave is kind of the coordinator of the event, and he will be MCing with Mr. Todd Andricks from the high school, so that's sure to be enjoyable, and they're humorous. Elizabeth actually is going to be singing a duet with her friend Alyssa Crum from Wicked.
Oh, nice.
Traveling Chamber, I think is what they call it now at the junior high.
Okay.
Will be performing. The jazz band will be performing. The Bad Tangerines are going to do a few numbers for us again. They've been there all along. In fact, it was Tammy Furch who actually started this whole thing from the Bad Tangerines. So we really appreciate her input. And Mile 5, which is a high school group of high school boys, will perform some percussion ensembles, and of course the staff. Tanya mentioned Mr. Harris singing. He may or may not be singing again this year.
Is that a surprise?
Yeah.
If he shows up, oh look, there he is.
We don't want to spoil any surprises, but there are lots of other staff involved, so that's always fun for the community and the kids to see their teachers perform.
What it sounds like to me is oftentimes when we do go to concerts and band and choir concerts, you see one group of kids, but this sounds like a wide variety. You're going to see many different age ranges, and you're going to see a whole wide variety, so it's kind of a little sampler of the music programs that are here in Owatonna.
It is. It really showcases, and that was Tammy's dream when she approached me back in 2010. She wanted to raise money for Music Boosters because it's been important in her life. But she really wanted to showcase the kids because she knows how talented they are. They're, full of singing and vocal and, well, that's the same, band and orchestra. There'll be string. It's really a great concert. And you know, besides the fact that we want to raise money, we really want people to see what great programs we have.
And become invested in it.
Right.
So that not only just this one time when you come to this, but in the future they'll be willing to maybe come to more concerts and invest in other ways as well. Tanya, you have children.
I do, and you know, I was just thinking when you were saying that, Shelley, we haven't gotten to the high school yet. That's next year. So we haven't really, you know, been a part of that whole musical scene, but this was a really great introduction. We brought our kids. You certainly can bring your children to this concert. I think it was really great for them to see, wow, this is what happens when you get to the high school, and look at all these talented musicians up there.
I'm going to be awesome.
Yeah! So, and the other thing that I will say is that when you do go to see a concert, obviously it's a group musical experience, and you don't get a sense of the individual talent that we have, so this is an opportunity for some of those students to share you know, their individual talents. And I believe we even have some junior high school soloists or small groups. So I think it's going to be great.
Well, I wanted to ask you, with your children in the music program, what kind of benefits have you seen for your own kids and for your family?
Well, I have two girls, one that just started the viola and a second one that plays flute, so we're both band and orchestra. Okay. They tell me it's orc dorks and band geeks. So I have one of each. It's been great. Just it's another way to express yourself. It's a way to meet other kids that's a little bit less formal. It's an opportunity to go out into the community and do something. So it's been really good. We're also a musical family. There are so many musical families in this community.
And why not take advantage of that in an event like this?
Yep. And you know, I know Polly has talked about, and Elizabeth talked about scholarships. There's so much that we do with this money, and I think people need to know that there's a lot that we're doing. We're helping out students that can't afford to go to camp, but we're also helping the music programs, purchasing things for them that they wouldn't otherwise be able to get. So,
well, tell us, Elizabeth, a little bit about the details of the event, when it is, and that kind of thing.
Well, it's this Saturday, January 12th, and the silent auction starts at 6 p.m., and then the concert is at 7. And you can buy tickets at Kottke Jewelers, Tone Music, or from any board members, which are listed on the website. Okay. And you can get reserved seating for $15.
Ooh, which is huge for a concert.
Yeah,
because usually
nice
people are throwing elbows and chairs and stuff trying to get the seats.
Very true.
Nice.
And for adults, it's $7, and then for students, which is 18 and younger, it's $5.
Okay. Now, tell me a little bit about your song. What are you going to be singing?
I'm singing with one of my good friends, Alyssa Crum, and we're singing "What Is This Feeling" from Wicked. Okay. So we've been playing it for a while. And
have you had a chance to see the play Wicked?
I have seen it, yes.
And so, do you have aspirations to maybe be on Broadway someday yourself?
I don't know, it would be kind of nerve-wracking, but it would be fun.
Yeah,
it would be cool.
Good. So, just really quick, Polly, why don't you go ahead and tell us a little bit about how you've seen music affect your life and your family, and why people should come and see this concert.
Well, again, it's just, first of all, it's January, and I've been told, going to be really, really cold this weekend. So
why not be inside with a whole bunch of other people?
Exactly.
Share the
Not a lot better to do. Yeah, it's just a great showcase of the talent that we have. Like Tanya said, there's so many musical families in Owatonna, and I know in the past 2 years, that's the main thing that people walk away from, besides raising money and being supportive. It's just a great, fun evening. The silent auction has a lot of great...
do you have some little tidbits for us?
We do. We have a lot of musical baskets and things, but we have tickets to some fairly decent theater. We have lots of restaurant things, pottery from the Arts Center, photography. Let's see. Oh, Wanger has donated special, like a practice chair and a stand.
Nice.
And, they did that last year too. So yeah, lots of great items. Like Elizabeth said, that starts at 6, so you can come and enjoy that before.
Good.
But it's just a great, fun, really fun evening.
It sounds like it's something you don't want to miss. It's an event to be at.
I think so.
Good.
I would say that. Yeah.
Well, I want to thank you so much for your time today. We're excited to see this. Good luck. Knock it out of the park, break all sorts of legs. Okay. All right, we'll be right back on the Owatonna Today Show.
Hi, I'm Amy Martinez, And I'm Adam Martinez, owners of Snap Fitness in Owatonna.
Snap Fitness is a fast, convenient, and affordable fitness center, and we're proud supporters of the Owatonna Today Show.
The Owatonna Care Center is excited to announce our new partnership with Dr. Middle and Dr. Wilcox of Long-Term Care Professionals. This partnership ensures that residents can be seen right here at the Owatonna Care Center when needed. With this special on-site care, long-term care professionals will be delivering to our facility. Our goal is to decrease hospital visits and ensure special one-on-one care for each resident. Long-term care professionals and the Owatonna Care Center are dedicated to improving the clinical management for our residents, ensuring that they receive the highest quality of care.
Hi, this is Barry Gillespie, president of ERA Gillespie Real Estate, where our pledge is to save you money, save you time, and simplify your life. And we're proud supporters of the Owatonna Today Show.
And we're back with the Owatonna Today Show. I don't know, we didn't say this before, but it's Elizabeth's birthday. So when you see her today, make sure you throw things at her and say happy birthday. Also, they wanted to mention that the Costas Candies is going to have truffles, and there's going to be Starbucks coffee available. And that's just basically, you can buy that. Yeah, so there's going to be all sorts of treats and availability. So that's this Saturday at the Music Boosters, so make sure you get over there. Also, the Owatonna Art Center wants to remind you of their water project. This is with Jack Mader Photography. That's starting the 6th of January, which was yesterday, through the 27th. And he's lead faculty department chair photography at the Minneapolis Community and Technical College. And he recently juried into the Minnesota State Fair Fine Arts Competition, so that's pretty cool. When he talks about creating this event, he says, in creating this portfolio of images, I could plainly see that anything can be, and indeed everything can be. So he uses water to convey this concept, talking about that. I just myself love the image of water, and so why don't you get over to the Owatonna Art Center and check that out. And he talks about how a single drop of water can make a difference, and in the drought season that we have, yes, a single drop of water can make a difference. And then, of course, don't forget it's the Steele County Historical. They're offering their radio broadcast. It's Jerry Peters and Armand Rizak are doing their weekly show Thursday, January 10th at the History Center in Owatonna. It's going to be a lot of fun. These two have been doing their show on KRFO, and they've been featuring big band music from the 20s through the 50s. And their big band show, it was originally started by Pink Allen, who just really didn't like the early 60s music and worked with Todd Hale and Bill Reisenauer to produce the show. So they've had a lot of fun with that, and they're going to be doing that Thursday, January 10th at the History Center. If you love big band music, and really, who doesn't, make sure you come and check it out and have some fun with that. Also, we want to remind you that the Autism Spectrum Disorder Group is having their event. It's coming January 22nd. And autism is sometimes an often misunderstood diagnosis, and sometimes people feel like it can be stigmatized as well. We really encourage you, if you know someone or if you have a family member who does have autism, whether it's your parent or even if you're not, really consider coming to this so you can understand what it's like to live with autism. That is this, not this Thursday, it's January 22nd, which is the fourth Thursday of every month. They do have this support group. It's at the Associated Church in Owatonna from 6 to 7:30. Now, childcare will be provided, so that'll give the parents and family members a chance to really talk about the issues that they have. And if you want to come and you do have children, please contact Tasha. She is at 413-0323. So thanks so much for joining us. We'll be back on Wednesday right here on the Owatonna Today Show.